What are you doing? You're on your phone. What are you doing on your phone? Oh, Facebook. Okay. Oh, now you're on Instagram. Okay, good. So have you prepped for your interview? You haven't? It's next week. Okay. So tell me, why do you want to do medicine? What, because you like communicating with people? Let me guess, that's your answer. Do you really though? Okay, at least you like sciences. But everyone's going to say that though. At least you've got your work experience going for you. Wait.
Hey guys, it's Celine, welcome back. So if you are anything remotely close to what just happened, I've got a treat for you. So today we're going to be covering the all-important question, why medicine and why dentistry? Now, we've got a number of reasons in our heads as to why you want to enter this career, and we can roughly say it, roughly, if someone asks us, I like sciences, I want to interact with people, but it's difficult to categorize the reasons and say it in a way that we really mean it. It's laid out perfectly in our personal statement, but to just, memorize that and recite it in an interview doesn't come across very, genuine. It comes across a bit staged. So to an extent, all of our answers will be a bit staged. I mean, it's obvious. It's a basic answer that everyone will prepare for, but there are a few things to ensure that it's as structured as possible, both in your own heads and for the people who are listening to it. Now, I believe that everyone's reasons for wanting to enter medicine roughly falls into 4 categories, and I use the acronym CAMP. So that's clinical reasons for wanting to enter medicine or dentistry, academic, management, and personal reasons. So let's cover all of this one by one. So firstly, let's start with, what am I starting with? C, clinical reasons. So we'll start with clinical reasons. So clinical reasons basically means the fact that, you like people, you want to interact with them, you want to build a rapport with them, you think you have a very empathetic nature and you want to use that to improve quality of life in the community, optimize patient care in a clinical setting. All of that is a clinical reason. So you'd start with something like, the first reason I want to enter medicine and dentistry is because of my volition to improve clinical care. And then you'd go on to talk about your work experiences and how you've shown your empathy or what you've observed and how that's really pushed you into wanting to do something in a clinical setting. So that's clinical reasons for why you want to do medicine/dentistry. Next is academic reasons. So a lot of people who enter medicine or dentistry and want to enter this career, they like science. But simply just saying, you like sciences, you're good at sciences, you get the grades, isn't really enough. You need to really understand what academics in these career means. So when I say academic in this context, I mean both teaching and research, in addition to, your basic sciences that you're going to be learning. So firstly, teaching. Now, you wouldn't be sitting in front of me, listening to me, rant about, interview prep and so on, if I wasn't a medical student. The point is, as a medical student and as a dental student, as a dentist and a doctor in the future, you have plenty of opportunities to pursue your academic interests, to do teaching, to give supervisions to people in the year below, to teach your colleagues, other medical students, tutoring people in school, etc., etc. So teaching might be a reason that you want to enter this profession. You want to share your scientific knowledge to other people who can benefit from it. Next, the other side of academics is research. So perhaps you want to use your scientific knowledge and anything you're going to build on in uni and use that to do research in a field that you're actually interested in. That could be neurology, that could be infectious diseases, you could make the next vaccine for the next pandemic. I don't want another pandemic. But the point is, you could use your scientific knowledge to actually benefit mankind in the future. And that could be one reason you want to enter this profession. So that's academic, both teaching and research, in addition to the whole opportunity to have lifelong learning. That's all academic. third reason that you might want to enter medicine or dentistry is management. So this is a bit of a niche one, okay, so bear with me. Now, in this profession, as a doctor or as a dentist, you'll have plenty of opportunities to showcase your leadership skills by managing a team. Now, that could be, something as small as small group teachings, or it could be MDTs in hospitals and wards, or it could be managing hospital trusts or GPs in the community, or just coordinating GPs in the community, or it could even be managing and owning your own private practice. So a lot of us have low-key goals to manage hospitals or manage private practices in the future. And that's what medicine and dentistry will provide. Therefore, one reason for wanting to enter medicine or dentistry might just be management. It's completely up to you to whether you want to use that one, but if you are going to use it, just make sure you practice saying it really, really well in front of a video camera, just so you get your point across really well. Yeah. And the final reason is personal. Okay, so a lot of us have personal reasons for wanting to enter medicine and dentistry. I myself had a family member who had gone through a specific condition, and that's what first gave me that spark for wanting to do medicine. It might be the same for a lot of you guys. It could be something as simple as getting braces that pushed you into thinking, oh wow, they really made a difference to the way I smile and the way I interact with people. I want to be able to give that to someone in the future as well by being a dentist. So that might be one of the reasons you have chosen this career. My point is, if you are going to say a personal experience, definitely do say it. It's completely up to you, but if you are going to say it, don't be shy, don't be afraid to say it, and definitely practice saying it in front of a video camera. Record yourself, watch yourself. It might be a bit embarrassing at the start, but do record yourself saying it, watch yourself. The reason is, you don't want to come out that interview thinking, oh, I just waffled through my personal story, didn't I? I didn't really do it justice. You don't want that to happen. So really practice saying it, do justice to the story. And if that has genuinely pushed you into wanting to do something as noble as medicine, then you should be proud of it. So be confident with your story. So there you have it. Those are the 4 categories for why someone might want to do medicine/dentistry. Completely up to you in which order you prefer to say these. Like, you might want to say your personal experience first, followed by academic interest, then clinical interests. You could shuffle them around. But the point of this is to give your answer some sort of structure. You can introduce your answers with these key terms like clinical, academic, personal, management, etc. And importantly, it's really useful in your conclusion when you're summarizing that all-important why medicine, why dentistry question. Something like, therefore, to summarize, I would like to enter medicine because of my clinical interest and my academic interests. Or you could say something like, although my initial reason for wanting to do dentistry was motivated by personal experience, combined by my work experiences and my academic interest for science, I've really gained insight into the academic and clinical opportunities that dentistry and medicine presents. Okay, so I hope you found this video really useful. If you did, make sure to save it so you can use it as future reference when you're practicing your why medicine, why dentistry answers. And as well as saving it, make sure to share it to others who you think might find you useful. Write down in the comments below what you want to see in the next video. I will be reading it, I do take it seriously, and I'll see you in the next video. Bye!